Great. Today is the session which we are having the 18th edition. We have started this journey in January last year. And the whole intent of doing the webinars and the podcast with industry experts is to help us understand the industry a little more better and to also share knowledge. So, with that intent, we have been struggling to get a good speaker for a topic which is very much relevant for all of us, which is talking about the possible new roles of marketeers in the AI world. So when we are talking about AI world, we are in the era where we want everything at speed. And AI tools are helping us in terms of increasing the quality of the work that we are doing. But let's remember that AI is not close to human performance. That's what I was told yesterday in a session where I was watching Nikhil Kamath and Sam Altman from ChatGPT, when Sam told very clearly that AI is not close to human performance. So he told that Nikhil, being a podcast, his role can be replaced, but the fan following that he has, the emotional touch that he has, cannot be replaced by AI. So in today's session, we will unlearn and learn many facts of how AI can leverage to do business smarter, faster, and better. So this particular session, we will be starting sharp at 12 o'clock. But before that, I would request all the people who have joined us today to please put in your name, location, and background. Please park your questions to the speaker in the chat, and we will be happy to take these questions end of the session. We intend to close the session by 12:50, 1 o'clock, and post which we will be taking all the questions. Keep your notes, keep your notebook and pen ready so that there will be a lot of things which we are going to talk practically, which you can implement in your business. So while you keep your preparation ready and keep your videos on so that we are in a better position to interact with you and also see your reactions. Plus, we would request you to please put in your name, location, and background in the chat. Thank you. So we've got about 175 plus registrations. This is one of the record that we have touched, being the 18th webinar. We have got people from various industries, various companies who have joined us. And this particular session, which we are going to talk about AI, uh, Rajneesh has joined from Dehradun. Thank you, Kalpana, Bangalore, Nikhil, Mumbai. Great. We have got Nikhil. Nikhil, no doubt, Pawan Kulkarni is an industry icon, and it was difficult to catch him and convince him to be a part of this. Jivan has joined us from Mumbai, Satyam from Ahmedabad. Welcome, Satyam. Welcome, Jivan. Kalpesh Bhai has joined us, and he has been known to us from 13 years from the day that we have started our journey. Jayashree has joined from Mumbai. Advocate Smita, who has joined us from Mumbai. She's an advocate in trademark and patent. Suyog has joined us from Mumbai, Bindu from Mumbai, Shailesh from Mumbai, welcome. Subodh, who has joined us from Mumbai. We got many people, so the introduction is definitely happening here. Let me talk about myself. I am from Hyderabad. I am passionate about cycling, dancing, and reading. I have completed my master's in marketing communication from Symbiosis Institute of Business Management in 2004. I have the experience of working in telecom, IT, as well as pharma industries. So I was also recognized by Business World 40 under 40 in 2021, being a healthcare power list. I started off my journey into entrepreneurship in 2012 with Medgini, and I'm fortunate to have friends from the industry who has helped me learn what exactly is the need, gaps, challenges from the industry. And at the personal level, I stay with my parents, my wife, and my son based out of Hyderabad. This is how about me. We have got a wonderful speaker for all of you, Pawan Kulkarni. Welcome, Pawan sir. And Pawan Kulkarni is a close friend. I have been knowing him since 12 years, the one that we have started our business. And he was kind enough to meet us, guide us on what we have been doing at Medgini. Pawan has started his career as a medical rep in Wockhardt. He has shifted to advertising and entered into healthcare advertising when it was in its early stages. Part of the agency that introduced Pawan to pharma using audiovisuals, films, teasers before launches, and brand retainership. He has also worked for companies like Genberg, Alchem, Elder, and JB Pharma. He has a rich experience across sales, marketing, product launches, public relations, corporate strategies, and digital initiative. At JB Pharma, he has joined in 2012 as marketing head, later moved to corporate strategy, new introduction, and digital transformation. He has launched applications and platforms for doctors and field people. His recent achievement, he has conceptualized and co-authored a book, Healing with Algorithms, the first of its kind AI book for doctors. He is often a speaker in pharma forums and MBA colleges as guest speaker. He often writes articles on his favorite topics of branding, marketing, and digital in Times of India, Economic Times, Medical Dialogues. So welcome, Pawan. Thank you so much for sparing your time and being a part of the 18th edition of the webinar today, where we are talking about the new roles of marketeers in the AI world.
Okay. So first of all, thanks for inviting me, and thank you everyone for sparing this cool Saturday afternoon. And Bombay is not raining for those who are not from Bombay. It's quite sunny, so I could go out and have some time and then come back. So
Good to
that's
hear.
a fun part. Normally I have reduced in terms of going on forums and this thing. Ashish met me in the time last time in Bombay, and we had a random discussion when me and my co-authors were trying to research for that book which you mentioned, Healing with Algorithms. We had studied around 200, 250 reports and all, and it was like hell of things which were totally going bouncers for us in terms. Now, what will be the impact in medical? We are not a medical people, but we wanted to compile something together for doctors to understand AI, in a very short, not making it lamba gyan book and all. So we made a small book, and by that time I had some thoughts in terms of what might have. And Ashish and me were discussing on this topic, and then why not correlate this? So this was a part of session even in my company I did for some time, and I keep talking to friends and this thing. So it was a very interesting compilation. And trust me, I'm not going to give you any gyan, no principles. Trust me, you guys know much better than what I know. But what I'm trying to share is what I have understood, or trying to assimilate what might happen in future. What are the kind of new roles which I have picked up from FMCG, especially from companies like cold drink, shoes, how the decision journey. So it is not about marketing which I want to discuss today. It is more how people are behaving, and that will in turn has an impact on changing how marketers have to behave. So the old school thought will not remain. So that was a whole concept which we thought we put up this as a session. Thank you for all of you for joining me today. So can I share my screen?
Yeah, just a minute, Pawan bhai. Allow me to just complete these two things. Uh,
Yeah.
the today's session, we will be having a lot of opportunity for you to also get a book which is from Subbarao. Subbarao is the author we all have been resonating, learning, because he has written more than 15 books in the pharma industry. He has experience in the pharma industry. And the recent book, which is talking about storytelling in pharma, and whispering to AI, prompt engineering for pharma brand managers. So we'll be popping up questions which will be coming in front of the screen, where you have to be very, very active. That may come very random based on what exactly we are discussing with Pawan here. And here, when the person is responding faster, there are 5 opportunities for the people to win this particular book. We'll be announcing the winners at the end of the session. And this book will be delivered hard copy to your doorstep. So the winners will be contacted by my team and the book will be delivered to your place. More than winning the book, I think the crux of the entire session is to learn from Pawan and to implement it tomorrow in your business so that you get a leverage on what exactly is happening in today's world. So this is what I wanted to share with you. End of the session, my team will be taking a week's time to craft an ebook on the conversation that we are going to have today with you and as well as Pawan. And that is about the topic, which is possible new roles of AI, of marketeers in AI world. And that's how we have planned the entire session. Please be there with us. End of the session will be closing by around 1 o'clock, but we'll be open to question and answers from 1 o'clock to 1:15. And I have requested Pawan to be there with us till we answer to your questions to the best of our capability and capacity. Thank you so much. Pawan bhai, please, over to you.
Okay. Can you allow me to share? Okay. Fair.
Yeah.
I hope visible.
Not yet, but yes.
Yes, visible.
Okay. Fair.
Thank
Okay.
you.
So interesting. I just heard, remembering, I was just thinking about what Ashish told just now, that Sam Altman himself had told that AI is not a replacement for human performance. That I could correlate immediately because recently I started, out of my hobby and interest, I joined a course for voiceover and dubbing. And there, even there is an institute run by a director and an ex-IITian called Ronkel Institute. And there I joined, and they were discussing, earlier the dubbing used to happen this way and that way, X, Y, Z. And now dubbings are done on AI. Definitely, what is happening is there were some seniors and all who were coming and explaining us how to talk, how to even pronounce, like what we learned in my school days and all. Those also we tend to do it wrong. But interestingly, what they told us, because AI is coming and coming up with a very proper diction, the artists are upscaling themselves. So that is where the human performance has no limit. AI definitely will help us augment everything, the same thing everywhere. I think all of you have heard all these statements much better places from other senior speakers and all. But this is very interesting that uh, AI is now, competition is not my competition is not my peer or other companies or other brands. It is AI. So how well I can do much better than what AI can deliver. So let us see what are the possible roles in terms of marketers, which I personally feel this is happening. Whatever I am trying to show you is all practical research, what I have learned in last few months of understanding these things. So basically what is happening, just hold on. Before that, official disclaimer. So all the views and opinions are my personal and nothing to do with my, you hear that disclaimer after insurance. So this is a disclaimer. Everything is on me, nothing related to my organization. So what will be your take at the end? So I'm giving you the last slide first, but I'm taking you through a journey of a story which I want to explain, trying to explain in a more simpler way. So what you're going to gain at the end is what I try to coin as meta. Meta has nothing great. It's nothing this thing. It is just meta is a word which I tried to coin based on what four things which a marketer has to do, precisely because meta word is memorable. So nothing else. I am a lazy person, so I don't remember all the long jargon. So I try to remember things with abbreviations. So this is what I feel is the end result of this session. So what are the traditional roles? Now, since the topic is all about what are the marketing roles and what might change. So what are the current roles? Since 80s, as I was a kid then, I'm still a kid. And since 80s, what were the kind of products and what were the kind of role of marketer? How was the focus area? What were the tools they used? What were the skill set they had? So these, I think, they were earlier until 1995, where not much of satellite and all were not there. So that were when distribution was more important. Like If any senior people are there, they'll understand that pharma companies in earlier times, giving example of pharma, those who had a strong reach, they were the kings. Somebody had the capacity to reach far and wide, they were the kings. Later came how well the brand was established, the concepts, and now the brand building has taken. So that is how the transition pharma has also taken. So if you see earlier, more of a product pushers, there were no much competition and all. Now there are multiple competitions. Like I always give an example of 1950s, two countries, two big countries, then US and Russia at that time. They had a fight. So there were two big things fighting. Now, over a period of time, what happened? There were no two big things. Now, there were many good smalls. So today also in any field, if you see the same tendency happens. Earlier, there was two big companies or entities or anybody fighting. Now there will be many smalls, many good smalls. They'll be fighting. So you take in terms of e-commerce, you take in terms of any kind of products, like in our childhood we never used to know any big brand other than Nike and Reebok. Today how many sports shoes and sports apparel companies are there which are much better than maybe those branding which were traditionally known. So this is how the transition has happened. So from a brand builders now customer centric. Now what is going on is more on customer centric, male, female, age group wise, this never used to be there. Like, for example, soap, traditionally, maybe even in now in some rural areas, soaps are sold in like what we buy paneer today. Many youngsters may not know soap. The bathing soap was only one, same. For कपड़े धोने का भी same था, नहाने का भी same था. And they used to cut it in 100 gram, 200 gram, big cake, and that was how. But now it came male, female, to the level that, it became face wash, hand wash, vaginal wash, so many wash. Today, I'm having a very good story that I can sell a soap which I can tell that left hand wash and right hand wash. So that also is possible today in the marketing space. So that is how the evolution has happened. So why I'm giving you this context is try and understand and correlate what is happening over a period of time. Many of you might be experienced 1 year, 2 year, 5 year, 10 years. Now see the change which has happened, and without knowing or unknowingly, you have adapted to it. Nobody taught you how to use Facebook. You never attended a IM or a big session class to know how to push your videos on Instagram. You learned it. So that was how things were coming up. So let us see what is the rewiring. What has happened over time? Now, earlier, in a summarized way, word of mouth. 15, 20 years back, 30 years back, when we wanted to buy a car or something, we used to go and ask the showroom, we used to go and ask some friend who has bought that car or that particular phone or whatever. That was a human trust. Over a period of time, when these digital things started, that was a phase when the reviews and all started coming in. There were smartphones, which smartphones has a very interesting. When smartphones came down by 10,000 every month, even today, as per Google Analytics, it is told that every month 1 crore new smartphones are being put in the market, and that is why you see so many smartphones coming up with more and more features and also many being launched. So every month 1 crore new smartphone users are added. So that is it. And there, what happened? User reviews and all. Earlier, you used to ask friends, how was that film or that product, etc., etc. Today, you just see the ratings. You just try to see the Google or anything. Now, then came influencers, how well they are pushing. So even the films, everything, I think, are being pushed on reels and all, so that to influence things to the consumer, to that AIDA model, attention, interest, desire, action. So that attention and interest model has come into more into digital space. So this is one major change. So what is happening now after this? I'm sorry. I recently saw this last week in Economic Times. Now look at these numbers. Look at these numbers. Britannia says almost 75% of digital commerce business is now coming from quick commerce. Commerce accounts for 35% sales of croissant and 50% of brownies. Company using IT ensure full rates. Look at these numbers. Thousands and thousands of crores are shifted to quick commerce, not the typical Kirana old store. Many of you might remember. I remember going out with my mom and dad when I was a kid, one day in a month to buy all the groceries for that month. That doesn't happen today. And in especially places like Bombay or so the core change has already started. That is what I'm trying to say. Pushing products to building brands to engaging digitally, now using AI ecosystems. So now it is that is impacting. Now again, I'm telling you nothing. I'm speaking about marketing principles. I'm not talking about anything. I'm trying to understand, and even I had tried to put in these slides is what is happening with the consumer, how they are reacting. Now you decide what are the new roles. Can we have a question here before we go further? So I think Ashish had some questions. We can start with the first question.
So the first question is basically in the AI era, is it possible to be everywhere on the social media but still invisible to your actual buyers? So we have got four options, and we have got the opinion poll from people who are responding. We are able to see the responses here, and I see that the people who are telling that yes, it's without prompt engineering, AI ignores you. So this is what people are feeling so. And we have got the second question as well. The second question is relevant to what Pawan is sharing with us now. Before we put in the second question, one thing which I wanted to ask with you, Pawan, you have been talking about quick commerce and how it is actually taking a significant role in the era of FMCG. How exactly is quick commerce playing a role in the pharma industry? How is pharma companies actually leveraging on quick commerce?
You're asking me?
Yeah.
Yeah. So see, interestingly, quick commerce, I think Zepto now recently had a press release that they have started in some cities, Bangalore, Delhi, Bombay, and Hyderabad somewhere. They have
Yes.
started quick commerce and medications. Now, technically, which I feel is, quick commerce is simple logic. I mean, I go by simple logic in terms, अगर आपका पैर टूटा है, so you'll not wait for quick commerce to come. You go to doctor and finish and take it up. So I think quick commerce will be helpful for more of a chronic categories, more supplementation, nutrition categories more than the acute categories. At the same time, if it is coming from quick commerce, it will definitely help the acute part because
Yeah.
it's more on late night, something is wanted and chemist shops are closed. Typically, what happens today. So the same behavior, understand the principles will not change, whether you are buying a bread or whether you are buying a betnazole or a particular antibiotic or anything. Human behavior will definitely, we all will have a same this thing. And this, I'm not saying this, multiple research says that. So that is what I feel. I'm sorry.
Yeah, so I think yes, more than anything, I feel the chemist universe that we are having, if we need to leverage on the infrastructure which is already built by them in terms of they have invested in terms of resources, in terms of people, and if a particular quick commerce is able to leverage on the existing infrastructure that we are having and use them as a point of presence and take the medicines and get it delivered to the nearby demand where it is getting generated. I think acute, chronic, both will definitely suffice. We're definitely looking forward for a player who can actually kill the gap of availability as well as the nearest delivery of the medicines at the quickest possible. So, with that, we have the second question. Surya, can you please pop up the second question for us? So, we'll be having five questions across the entire webinar, and the people who are responding the correct and the fastest will get a chance to win the book Prompt Engineering from Subarao sir. And we have also requested from Subarao sir to be a part of the today's session. He is currently there in US, so he is unable to join. The second question is about risk of substitution. The question is being popped up in your Zoom. If you are able to see it, please let us know. If you have any challenge, please put it in the chat. The question is, if tomorrow AI quietly starts suggesting another brand over yours without the customer ever searching, how soon would you notice? So will you notice it immediately or within a few weeks as marketeers? So we are talking about as marketeers, what exactly do you feel will happen if AI will start recommending alternate brands to your customers? Your customers may be patients or doctors or chemists. So this happens not deliberately, but this happens silently. So will you notice this? So we have people who are participating. I think more than 40 people have participated. And I see most of the people are tilted towards the option 1 and 3, which is immediately they will see the response, or they will see that probably never unless you are in the AI decision path. So yes, we will be sharing the winners of this particular contest. And let me share the result to all of you. Yeah, so if you are able to see the results, give me a thumbs up. So the option, the highest is a tie. It is basically immediately and probably never. So this is a tie, but there is a correct answer to it, which we'll be sharing end of the session. So with that, Pawan, please continue.
Yeah, sure. Very interestingly, I mean, there's a mix of answer. I was not expecting this answers. As I said, principles remain same. Whether it is, when marketing as a role, there's very good statement by somebody I read somewhere that there is nothing called as digital marketing. It is only marketing in digital world. So how many brand managers actually go and read the textbooks what the doctor reads? Only until and unless something major thing comes up or some senior has given that happens. But otherwise, medical textbooks, journals, physical journals, going into libraries, that is something which is very important to have. Now coming to very interesting story. Now, this part actually hit me to think about this angle. There are more than 120, 20,000 customer pulse. Pulse means a survey from more than 15 countries. I think at Accenture, multiple companies have published this. This is of one of the companies, report available free online. What does that say? Nearly 1 in 10 consumers, that is already 9%. I mean, I'm talking about 2024 now. ये एक साल पुराना है. 9% in 2024 already rank Gen AI as their single most trusted source of what to buy. Now, as I told, I'm not saying anything related to marketing. I'm talking here what is happening with consumers. Almost 10% in 2024, they are single most trusted. Another same report, it also showed 36% of active Gen AI users consider technology as good friend. Now, what does that my good friend means? They even ask their personal psychological questions. I'm having a low mind today, or I'm feeling low, or somebody told me something, how to answer. My boss is not this thing. I'm having trouble in my relationship. Relationship questions are put to AI. This is in the report. So, interestingly, the point when we used to go and be, asking a question to a friend or a senior or somebody as a, close on a personal basis, now everything is going on AI, not just Google, because AI is one step ahead of Google algorithms. Now imagine what is happening. Another very important part, which actually started, my thought process and all. A purchase recommendation, which is happening. Gen AI has become the most important, decision influencer. The most important, अगर हम कार खरीद रहे हैं, कपड़े खरीद रहे हैं, we still have that, Amazon में, whether it's fits our size, how's the material, touch and feel. This was a physical store. Now that was where it helps us decide and take a call. Now, Gen AI has become the second most. Now, imagine social media, online marketplace, friends, family, these are second. Very interesting. This was the most shocking part for me, which happened in last 2024. 23, I think if I'm right, 2023 starting ChatGPT was released, and 24, this is the impact within 1 year. It's far more than how digital impacted the industry or the consumer or in general. So the same thing, why I'm talking in general, this thing, the same behavior will go with the patient, the same behavior will be having with the doctors. Ultimately, they are all humans. One more thing, Saturday 9th. August. Example. This was on the front page of Economic Times. That Gen Z is planning their holiday asking a chatbot. Imagine what is happening. Gen Z is now planning their holiday asking a chatbot, not even their parents or somebody has gone or seen somebody's Facebook or seeing somebody's photos. Nothing. They are asking where to go on holidays for better ideas. यहाँ है, वहाँ है. It is going on chat. Yesterday I was doing some research for some other thing. I found this. There's a website called, I don't know how many of you know, who gives a very good traction on other worldwide websites. It's a heavily paid website, but some versions are free. It's called Similar Web. Similar Web, you can go and check a lot of website traction, how the particular website. When I was checking for something on that, I scrolled down and this was something which came shocking, that top referring websites for whatever I was searching was ChatGPT and not laws related or pharma compass related. I was searching something related to legal aspect. I can't tell what I was searching, but I was surprised that ChatGPT is the highest recommender for this. This was yesterday's my shocking. So this part I just added in the slide in the morning.
Perfect. Harvey is another platform which is widely used in US for legal GPT.
Yeah,
Right. And ChatGPT, what I was come to know, Pawan, is that they've got close to 1 billion users and they've got more than 2.5 billion prompts which comes to them. And 45% of the users are less than 25 years of age.
absolutely, absolutely.
So, मतलब just imagine the acceptability and the adaptability of AI to the new generation who are less than 25 years.
Absolutely. They are Gen Z. Now, with AI integrating consumers, what is happening? Continuing with the same survey, 1.5 times more engaged. They are finding it more engagement, more likely to recommend, 2.3 times. If AI is recommended, it goes in the subconscious mind. That is what is happening. That kind of trust is happening. 1.7 times more likely to accept a higher price point. So, that also means how I see this as, if ChatGPT can recommend your brand, even if it is expensive, your consumer will not have a second thought to buy it. These are all cut paste of those reports. Additional, how they are seeing subconsciously, what is at a psychological point? We were talking about just now on quick commerce. There is a psychometry or psychological report which was published 6, 7 months back. Why these quick commerce is picking up? It is not because of the convenience. Convenience is a outcome factor, but at an innate psychological factor, I mean, what these psychologists or these researchers told, it is a habit of a human to feel empowered, that just with a click, whether I'm sitting on a sofa or on a toilet seat, with just a click, I get my materials within 5 minutes, 10 minutes. So that was a kick, a psychological kick which was giving. It's not the convenience factor. So understand the background. That is the insight here. So that is the same thing will happen to even medicine. Earlier, it was available in not quick commerce, e-commerce. That used to take days together, 15 days together. There only chronic elements were picking up. Chronic, therapies were picking up. Now with quick commerce, it will be painkillers, short term, these things, cough syrups and all that will also pick up. So this is how the ring, the psychological ring, which is happening with consumers. The AI is as my second half, second self, my loyal companion, and the trusted guide. This is how psychologically people are taking this. Consumers are behaving, and the same thing will happen with doctors and patients. Trust me on that. We made a statement in our all promotions, everything, that your next competition for your brand is not a brand. Your competition, which you normally think as a brand, may not be a brand, but it is a bot. Whatever companies do, your competition do, anything do, it will be secondary, which I see as coming in next 1 or 2 years, which I see, based on AI trends, which I was thinking in my personal opinion maybe 5 years or 6 years. But looking at the speed at which AI is self-learning, it may happen within 1 year or 2 years. And many of the sectors, it has already happened. Example, I'll give you a very interesting example very soon. Now, I don't know how many of you know, there is something called as agentic AI. Now, agentic AI is a concept. Now, 15, 20 years back, we had heard a joke, or maybe those times jokes used to come on emails and all. We didn't have WhatsApp and all. that somebody called some McDonald's or something, and that the other side, the guy knew everything. You are diabetic, so I'm not putting the cheese. You are having a high sugar, so I'm not putting the salt. This thing, everything, so many things.
He knows
It
your
would be
bank
funny
account
that,
balance as well.
sorry.
He knows your bank account balance as well.
Yeah. So agentic AI is actual reality now. So if you are saying that it will understand your pattern, so if you are using ChatGPT, I think all must be using ChatGPT. Just go back to ChatGPT and just type, tell me about myself. Based on your searches, it will give you your personality because it has studied you. What kind of searches you do, what is your interest, where do you work, everything they'll, So what agentic AI does is, if you are telling in agentic AI, plan healthy dinner for 5 people tomorrow under 1,000 rupees. So what does it do? It will not just Google what does it do. It will give you recommendations based on the keywords you have given, that 5 people under 1,000. So these are the numbers. But agentic AI will search for your recipes based on your taste, whether you are veg, non-veg, you prefer chicken or mutton, where the mutton is more famous or chicken is more famous based on your dietary restrictions. So future will be like this. So this is how agentic AI works. No, agentic AI is an algorithm, right? So that can be integrated in multiple. So agentic AI is a conceptual name. It's not a AI platform, right? So bottom line, which I'm trying to say is, AI agents are now deciding what customers will see. So it is not your competition. Today, if you are trying to target somebody, your competition brand, all you need to do is, probably in coming future, you have to train your AI models that it gives much better and emotionally convincing answer about your brand rather than targeting they don't have this, they don't have that, we have this typical pharma. We always do this, that they are pellet form, we are not pellet form, they are powder form, we are in capsule form. These comparison will not have any meaning until unless these are all feature based communication which typically pharma does. But now it is not just a benefit based but also emotional benefit based. This is where your FMCG and consumer health always have been doing. So this is what is happening today. Question 3, can we come before I go further?
So, team, can we flash the question 3? Participants, please see the question 3, which is talking about AI dependency. If your brand name vanished from AI-driven medical assistance and e-pharmacy suggestions, when would you impact start showing? So, is it immediately in some therapy areas, or after 6 months, after 1 year, it won't impact much? So, what is the speed at which you will feel the impact is happening when AI-driven medical assistance and e-pharmacy suggest stop suggesting your particular brand? So sooner or later, we will see that these are the silent killers who may probably make or kill your particular brand. So how to be present in this particular platform and how to be leverage on this particular platform with regard to visibility and availability is very, very important. So a lot of them are opting out. So we've got more than 50 people who have participated by now. Great. So we end the poll and we will flash the results now. So there is some technical glitch, team. The answer, so about 76% of the people are say that immediately in some therapy areas. This is what people are saying. And with that, we will now go to the session back to Pawan.
Okay. Thank you. So
Yeah.
that was an interesting question placed very rightly before I come to the point. Okay, so let us go to the next slide. So what is a big question? I presume almost everyone is a marketer handling some or the other brand, right? So my question to you now, why we told you to keep a pen and paper? Because what I'm trying to tell is not about the slides or anything. There will be many things that will come in your mind. Please note them. These you can do try on on your laptop or think again. So please do note these points. Now my question would be this: is your brand in the path of AI's decision journey? Difficult question to ask. And for those who didn't understand what is the AI decision journey, we always used to talk about what is a patient journey. For a patient journey, for example, if he is having cough and cold, the journey may be for 1 week. He takes home medication, nothing happens, doesn't get cured, and then goes to a doctor, and this is a journey. For a diabetic patient, it may be 1 year, 2 years longer. For a cancer patient, it may be 1 year, 2 years. So patient journey where he goes from GP to a physician to a surgeon to a operation and coming back. All these things are journey part, which I need not tell you. The same thing is also a doctor's journey, which very few people in pharma observe. The first, what they write, that is why guidelines are important. Doctors think by guidelines, practicalities. They think by guidelines for antihypertensive, maybe anti-diabetic, but they may not think guidelines on nutritional supplements. So these are very important points when you understand whether your brand is in the pathway of AI decision journey. At the end, I'll tell you how to bring this sitting on your laptop. Right. So why do reviews these matters? In India itself, 81%, this is an Indian study, 81% Indians use social media or some or the other social media, including AI or even in general, your post and Instagram reels and all, to seek reviews before buying. And that is one of the reasons you will find more of a doctors coming online. Doctors are becoming reel makers, and that is a big benefit for them as well, because they are getting a platform to show up and have a good reach, know their patients, and let the patients also understand more basics directly from a doctor. Indians read reviews higher than global. This is very important. I remember when I read this report, Indians का typical है, when we buy a car, कितना देता है 1 लीटर में. So this is a typical habit of Indians that we read reviews a lot and decide. And your positive reviews, negative reviews have a lot of impact, and that is why many of the companies on Amazon and multiple things, they put reviews in a trying to be positive or neutral or way where uh, next set of buyers or potential buyers are influenced. So what is the new job? The new job is how you can bring AI visibility of your brand. You might be thinking, some might be thinking, अरे मेरा तो antibiotic है, मेरा तो cardiac brand है, how I can bring it in AI? It can be possible. It is. I'll give you some live examples as well, which may or may not be knowing, but you'll be surprised the kind of examples, live examples, I mean, which I had done. So AI visibility, mapping accurately, and how to integrate with the disease and the journey. That is the new job which you'll have in this parameter. Coming further, you have to invest in AI-enabled tools. As a brand manager, maybe 1 year later, 2 years later, this will be a part and parcel of your KPI. Yes, we always say pharma is a laggard in understanding digital and all. What happened? Imagine what happened in digital. I was told by in one of the session very interestingly in when computers were introduced in banks many years back, right? Many of you may not even be born at that time. जब बैंक्स में कंप्यूटराइजेशन हो रहा था तो बैंक्स वेंट द गवर्नमेंट बैंक्स वेंट फॉर अ 2 day strike, thinking that because computers are coming, our jobs will go. And what
Right.
happened? The whole banking structure changed. It speed up. Now, how many of us go to a bank? Everything is on our mobile. So the same thing which happened in digital will repeat in AI, but at a much faster pace. And the same principle long back which we learned, garbage in, garbage out, AI is also the same. So you put the garbage in, your question is a garbage, the answer will be a garbage. Why? I'll come to that point. Next pointer is brand loyalty there. I was always told by very big gurus and branding gurus, you can't buy loyalty. What you are having as a prescription, regular prescriber, this thing, it is just a consistency which you are. So brand loyalty is very different. In pharma, it seldom exists. It doesn't. There's something called as emotional algorithm management. This will be the new role you need to understand as a brand manager going few years down the line. Any marketers. Emotional algorithm management. I'm not saying CRM is bad or this thing, but what is the difference? It will amalgamate. It is not a separate element. EAM, I see maybe next 2 years, 3 years down the line will be a part of CRM. So what is basically the difference? CRM is simple. आपने क्या किया? All your CMAR, IQVIA data, whatever they give as a prescription. Track what the customer did. Customer इधर गया, He ordered this, he prescribed this at this point for this indication, for this co-prescription, he prescribed XYZ brand with along with this. This he prescribed in the morning, he prescribed in the evening. So these are this. But what EAM does is it predicts how the customer was feeling when he was doing it, how the doctor was, why he prescribed iron and calcium separate ways. As we know, in pregnancy, iron and calcium is prescribed in two separate because there is a perceptual understanding or maybe reality that iron and calcium interact and causes GI irritation. GI irritation is even caused by paracetamol also for many people. For many people, it doesn't happen. So any medication will cause some or the other way, but it is manageable, threshold level, everything matters. So EIM has a predictability of how customer feel. Example, simple. You go to a coffee shop, based on your name or number, those who are habitual of having 500 rupee coffee, I am not a fan of that because that amount gets me 1 month coffee powder at home. And my wife will be more happy to make me coffee every day. So point is, you went to a coffee shop, ordered a cappuccino, they know that last time what you had ordered. But this was CRM. But what is EAM? It is the thing that the moment you come inside a shop like Starbucks or whatever, wherever you go, the aroma of cappuccino hits you. And that is the reason you find a typical smell in certain number of shops. Not only, I'm not talking about only coffee. You go to Reliance Digital across, you might have certain, principle that they have to have these kind of smell, look, feel, यहाँ पे ये होगा. There's a very good book called as very old pre AI book called as Why We Buy. In Why We Buy, the book, he even mentioned the door of the cupboard where you buy is also decided based on the psychology whether you are pulling it from the right hand or a left hand. Purchase decision differs, and that is why you go to malls and all where they keep certain fridge related items, freezer related. Those doors are planned in a way that you have to open with the left hand and pull it with the right hand. So that level is EAM. So what is there's something called as another point which I want all of you to understand, which will be the future is this is AI arch typing, character typing. So what is AI character typing? Two things I told you. One, how AI thinks, how AI doesn't do a the SEO model. It doesn't take just the keywords. It also feels. AI also feels and gives output. It feels the context rather than just the keywords. Here it is more of a personality, right? Here, what brand personality is imbibed? I'll give you some interesting examples, then you'll get to know. What are the kind of role the brand does? Does AI know that? One. Some live examples I have put. Say like a molecule, a new molecule which is making a lot of waves, vonoprazan, a PCAB, potassium, calcium, PCAB category after PPIs which has come. Now, for some example, I get Captain Calm. So what happens in acidity, everything, it keeps the Captain Calm. Acid waves, speaks in calm, ocean metaphors. Can this be imbibed in AI model? Say, tell me certain steady guy, or something like a military kind of discipline correlated with BP. Typically, what happens in our visual aid, we talk too much of science and less of emotion. But in AI, we have to story tell what is the outcome because a non-science person is listening. And that will also decide. Metformin, a sugar controller, beats high sugar, whatever. For example, I have some dummy brands which I created. There is no brand existing. But what is that molecule? I just put it and I made some characters as per my thoughts. See what happens here. Sorry. So, bisoprolol, a cool-headed pressure controller, quiet optimizer, a gentle guide, a dependable, a quick response, a calm companion. These are storytellers. This normally doesn't come in our visual aids, but it has to come on our AI, archetyping the brand names. So this will be the very good, interesting future If you want, I'll share these slides. There is no brand. These are all dummy brand created by me. So what was yesterday, today to summarize? Earlier it was field force heavy, mass targeting. We all know. Currently we are hybrid, both. Some companies are trying on digital, they are using iPads, but they are not using iPads except what I see iPads as, glass on paper. Same PDF which was sent as a product monograph, it is now put as a PDF in this thing. So that is also not a complete utilization or a complete digitalization of iPad. Tomorrow it will be predictive targeting. How customers will behave. So what will be my next brand? What will be the co-creation content? How will my patient, a continuous patient, will keep getting update about what is happening to him, or how the brand narrative will be flown today? Earlier brand used to just say, you know if you see FMCG, brands don't say, they behave what they say. So that will come in pharma. Now I remember one very interesting case. I think some of you might have known, there was a recent case wherein Tata, that is Titan Eye Care, won the case against Lenskart. I don't know how many of you know. You know what they did? Lenskart used the words, remember this, Lenskart used the words Titan, Titan Eye Plus, Fast Track, these kind of words, and put them as meta tags. Meta tags are the HTML tags which are not seen by you and me while we are shopping. Meta tags are not seen by you and me while shopping, but they are in the HTML code in the background. So you are going on Amazon or some platform or somewhere digitally and you want a fast track. What will come? Lenskart will come. You want Titan Eye, particular chashma or something, a watch, or what will come? Lenskart will come. So these were considered by law as infringement. You imagine the level. You don't even know. You are not even seeing it. This level of marketing will be a new role. Though I'm not saying this is right, but as a case example, which a customer doesn't even know, you are searching for fast track, what is being shown to you is Lenskart. Your decision is changed. Let me try Lenskart. So case ruling was against Lenskart, and fast track. The Titan won this case because it was geotag. Meta tagging was wrong. So what is your brand story in this? Whatever brand you are handling. Is it helpful, inspiring as an expert or trusted or this thing, or faceless? What is your brand on AI? What is your brand on Google? If you go back and search your brand on Google, you go back and search your brand name on YouTube, you will definitely see some dumb guy sitting in some rural corner has made a Hindi review of yours brands. Do you want your brand, your customers to see this, or rather as a marketer, you will put your own video, your own content, your own whatever is plausible in compliance framework. So what is expected to happen in future? These are some points which I feel, based on my reading or my personal thoughts, or this thing, what might happen in coming years. Uh, your brand example. ये तो pharma हो गया, Starbucks हो गया. Now many of you might be thinking, भाई pharma example do. Let me bring some pharma example. Now imagine a doctor sitting somewhere is searching, and definitely he will search something like this. What new after HURA and PPIs? What will Google do? Or even Google now is having integrated Gemini. They gives, Google search earlier used to start with links, but now it is a summary which comes based on their own AI.
Yes.
What will it give? Or even ChatGPT. A generic untrained model will respond. Consider PCABs like monopresent. Bas, khatam. Did it tell the brand name? Did it tell your brand name? Did it tell your brand name 20 mg or 40 mg? This is possible if we build over a time. There's one more molecule called as fexupressin. I don't know whether it has come, but it's not there much. Monopressin is doing comfortably well, replacing PPIs and all. This happens if the the brand manager of this monopressin or fexupressin is contextually embedding and building content for AI to read. That is very interesting. This will be the future of it, which I feel personally. I might be wrong, or you might debate, but this is what I'm seeing based on what is happening in other spaces, and this is what is coming. Brand's character, what is a character that is, see, AI doesn't read words. AI reads character typing. So your brand should have a character, personality in AI. Then it will give out. What is the dialogue which is going on? I'll give you some examples. First and foremost request, all brand managers, please don't make mascots. It won't help. It doesn't make any sense. I have seen many brand managers thinking of a mascot and this thing. This is not the outcome of that. Some might be thinking, so I've just put that. Tell stories of discovery of this molecule related to, though you may not be the innovator or this thing, but your story embedding should be related to how, what was the history and this thing. The more detail, the more AI comes to you. Doctor patient transformation, how it has helped. How many of you handling this brand, whatever brand you're handling, know when it was launched? Who was the first prescriber? Who is the highest prescriber in the country of your brand? Try find that. Make stories out of it. And your field also will have a very good connection with that. Who was your first prescriber of your this brand when it was launched or whenever it was launched? So these are some of the interesting aspects. So prompting is very important. Uh, Discovery is what used to be in Google days. Going further, I think many of us also have stopped going to Chrome and then Google and then asking. Rather, we now go into ChatGPT and ask the question. The same thing. So it is discoverability is different, and now promptability is different. So if you are not, if your brand is not prompt engineered, it's practically invisible. This is what I was saying. AI reads context, not just keywords. So keywording is a old thing now, and over a period, it is required, but it is required now at a backstage. Now something else has replaced it, that is contexting. So brand contexting, story contexting, the situation contexting. So if you now search of some law firm or some anything that has happened in the news, AI will collect from various sources and give its own personality and produce it. So that is how it's going to happen to brand also. And now imagine not your role, but how customer will react. Now the role is how customers will react there is more important. So what is expected out of future? This is my personal take on this thing. Your next customer is an AI agent wearing a human hat. This is what I feel. And what will happen? In the red, the center column I mentioned. Gen AI reads thousands of reviews, offers confident natural language recommendations, and AI tools, EMRs. EMRs is electronic medical records. These things, and then collect it together and present it. So this is going to happen. This is what and this is where brand manager's role comes, whether your brand is there or no. It is not just that you have made a visual aid, you have sent some inputs, pen based, diya. Now the compliance is coming in picture, whether the input is available, allowed or no. So many of these things, the old passe will keep continuing as a routine, but as a thought process, as a marketeer, this new thinking has to be embedded. So AI will act in buying. Older touch points may get bypassed to a certain extent, but may not be completely. But brand managers should tap both AI as well as human this thing. So earlier it was told data is gold. You know, now data is not gold. The next wave which I feel is coming is whether the data is documented well, then it is gold. If your data is not documented well, it is not gold. Earlier, we used to say, earlier, the traditionally, I remember reading this Yuval Noah Harari, 21 lessons for 21st century. Very interesting book where he mentioned that earlier the power was with those who had money, who were kings, who had land, they were the kings. Then the change came, the power became with those people who had the ability to manufacture or bring in some new things and these things. But later it came to whom? It came with those who had data. Google, Microsoft, these. Now, when AI comes, which I feel is whether that data is properly documented for the use of benefit related to something. Since we are speaking here on brand, I'm speaking brand related, but it can be anything. It can be your personal branding as well. So it should be contact, consent based. Definitely, these are all regulatory aspect, consent based and all. So example, I just put some example here. Cough syrup. Now, when we talk about cough syrup, a typical, I remember a terbutaline or a salbutamol. How many doctors want salbutamol? How many doctors want terbutaline? Now, typically, which I see, I may be completely wrong, but certain level I understand that some doctors who prefer terbutaline will never write a salbutamol. Some doctors who love salbutamol may not write terbutaline combination. So whether they want non-drowsy, whether they want honey based, whether they want soft based, what flavor, what texture, God knows. But PMTs should now collect prescriptions, not just understanding why he wrote that, what flavor is the tendency. So there is a lot of opportunity to build stories, even the minutest thing. एक छोटी सी चीज को भी लेके you can build a story around. AI helps you with that. So it may not be a lost, your data, you see so much of data in terms of prescription and many other data, secondary and primary field inputs, your own surveys. But there might be many things which is small, but which can be made into a big thing using AI and a new story can be formed. And this is how it will help. Yeah, Ashish, can we have another question? She's, I think, yeah. So the next question is, which has a stronger chance of shaping future buying decisions? So this is a question. So these questions were particularly put so that you can understand, correlate these questions with your brands which you are handling. 10 years of brand loyalty, 10 seconds of AI, AI's emotional algorithm, neither price rules everything. Okay, for first time I'm seeing nobody clicked on price. Otherwise, all PMT always have a tendency that the other brand is less price, so that is doing well. Anyway, let us go further. 43 people. So who is going to train the AI? Last few slides. Uh, you have to as a brand manager. So what do you do? Now this part is very interesting. All the story you have understood, क्या हो रहा है, क्या है, I think I was able to give a gist of what is going on. Ashish, you want to say something?
Yeah, so there are a lot of questions which are popping up in the chat. We will definitely be able to take it up. The fourth question, which was asked by you, we've got good response from about 43 people out of the people who are there with us, and most of them feel that it take 10 seconds of an AI emotional algorithm is what they are saying. But nevertheless, we will be sharing the responses of the people who are actually winning the contest as well. And very soon we will be taking up the questions which are coming up in the chat. So, Pawan, please, over to you.
Yeah, definitely. So I know listening to all these things and all, I have not told anything which you don't know, you might have seen across. I'm just showing the data or my understanding, which I have seen in last few months on knowing about more deeper about AI. So what do you do as a brand manager? Next slide. First is you need to know what AI does. What you need to do as a marketer, what you need to do is what AI does. So ask the question about aciclovir. How AI, for an example, I picked up aciclovir as a random molecule. Though I've worked on aciclovir long back, now I am not working on any of the aciclovir or painkiller brand. My thought here was, why not ask about AI since I don't have any history of searching about aciclovir on my laptop, on my AI or my. So I was searching for something which is very neutral, which I have not searched. So I asked about AI. What does it do? How AI picks? How AI picks where all you should be. मैंने बोला आपको AI में होना है. Many of you might be thinking how I can be in AI. That will be the typical question everyone will ask. So where all can you be? AI takes from all the publicly available authentic forums. It will not go in any private forums. One. So like CDSC. You search for your molecule, when was this approved in India? It will take exactly date, this thing, everything because it is publicly available. NPPA listing, prices, wherever it is publicly available. They cross match it with e-pharmacy data. because online is only e-pharmacy, not physical. So for AI, for a AI platform, they may not know what is a chemist shop near your corner or anything. Whatever is available on publicly available site, it will pick up. So are we there on public those sites? Is your brand? Check trade, market share news, pharma biz, AI COD, IQVIA, or any press releases which has been done. Or if you have done 100 crore of your brand, have you done a press release? Is it there on your annual report which is publicly available on your website? So all these things AI will search. So our important role should be how we can be there with our brand. Verify company's official pages, again all publicly available. Social media, it scrapes from there. Social media से scrape करता है. So that is how AI works. It might be bias towards certain this thing. Again, I don't call it as bias, but it can be a good feature for the benefit that if the other brand has done some XYZ good session or good storytelling, it'll be biased. At the same time, AI will also hallucinate. Right, so be careful. Whatever AI, you will get a lot of quick information, fast information, but at the same time, it might even hallucinate. I asked one question. Now, this is a practical case. Very interesting. Whatever I have told in last few slides, I'm trying to explain. I asked this one question to 3, 4 platforms. Give me, just tell me top 3 brands of aceclofenac in India. This was my search. And see, this can be the similar search which a doctor can do. Am I right? So I first asked perplexity. Now, this was the answer. Now, look at the answer. Why Perplexity gave Zerodol by Ipca a well-known aceclofenac brand? Why did it give Intas Hyphenac as a popular for managing body aches? Why body aches didn't go in Zerodol? You are understanding what I'm trying to say? What I said? Imagine with WHO GMP compliant. Now, as a customer, common customer, if WHO GMP compliant facility, maybe other brands are not WHO compliant facility, but they may be. God knows how it happens. So this is what is the practical outcome of perplexity as a trusted brand indicated for osteoarthritis and rheumatoid arthritis. Why these two particular indication came with this? I don't know if the brand manager is here and Asenac is prescribed more for osteoarthritis or they have done some press report or some articles related to this brand. This happens. This is what I was telling. You have to be here. And tomorrow, this will be the necessity part of your KPI, KRA things. The same thing I asked ChatGPT. Same question. Now look at this. Frequently listed in top brand compilations in India. That means from somewhere it has taken where it was listed as top brand, or the list of brands, it may be not written as a top brand of aceclofenac is Zerodol, but it may be on the top. So frequently it has seen the top. That the same thing I was telling, it will not see the keywords, it will see the context. AI is all about context. For at least for pharma, though AI is for many things. Choice, common choice in pain management. Widely used aceclofenac options. Now look at Gemini, the same question to Gemini. And all these questions I ran at the same time, not that today, tomorrow, and day after. 3 windows, same time, click, click, click. This was output, and I have just cut pasted. Zerodol. I ask the next question. Why you gave only these, not others? Tell me 5 short bullet points. Now, I did this exercise to give a case for you all to understand what is happening. It took up based on market leadership. Remember what was my question? Give me 3 brands of aceclofenac. That's it. Now AI is thinking based on market leadership. Among the highest selling and most prescribed brands of aceclofenac. Who told it? AI is, who told AI that it is highest selling? It must be somewhere.
Market research
That
report.
is a, yeah, that is the role of a brand manager now. Reputable manufacturers, companies like Ipca, Intas, Aristo, Cipla. Cipla is not leader in Aciclo. Why this came? Maybe the word correlated reputable, which I feel. Widespread availability. Doctor preference. How does AI know what is doctor preference? But healthcare professionals frequently recommend these brands due to their proven efficiency and consistent quality. Who told it? किसने बोला उसको? Somewhere some trace is there. Somebody has done by default, may not be by this thing. There is a press release, there is some statement from the CEO. So, like XYZ brand is most trusted among doctors. If that person's CEO is having a very good traction, very good, social media footprint,
Fan following.
it definitely comes to that.
Yeah.
Another platform. Why you gave these, not other? Same question I asked the another platform. These brands sell most in their category, easily found in pharmacies nationwide. See, again, I'm telling. Frequently prescribed across all specialties, pharmacies and healthcare sites. So, are we there? So, my question is, if you are doing a brand plan or launching a brand, we always do visual aid hai, sample hai, LVL hai, first input, second input, visit 1, visit 2, visit 3, डॉक्टर लिखने के बाद थैंक यू फ्लावर, पानी का बॉटल, ये सब होता ही है. But have you decided what is the content you are putting on 1 mg or pharmacy? And at what context setting? If you are putting it as a blood pressure, it may not be as a blood pressure, it may be as a antihypertensive. एक common आदमी को antihypertension पता ही नहीं है. So understand these contexts. I created my own brand, Asimurac. There is no brand existing. I just told this is my brand of aceclofenac. What should I bring? What should I do to bring this in the top of your recommendation? Now see what AI says. Maximize prescription share. ये तो वो नहीं करेगा. प्रिस्क्रिप्शन भाई हमको ही करना है. तो अगर तुम्हारे प्रिस्क्रिप्शन बढ़े, कहीं तो मैं देखूंगा, कहीं तो मैं ये करूंगा, तो आना है. तो फर्स्ट आंसर इट इज वेरी क्लियर, भाई तुमको काम तो करना पड़ेगा. प्रिस्क्रिप्शन तो लाना पड़ेगा, धंधा लाना पड़ेगा, पर्चा लाना पड़ेगा. दिस वाज अ वेरी इंटरेस्टिंग. सेकंड, इंश्योर अवेलेबिलिटी. सब जगह हो. स्ट्रेंथन डिजिटल प्रेजेंस. Are we visible? Keep it highly visible on 1 mg, netmeds, pharmacy, and accurate content and patient-friendly information, not doctor-friendly. This is not my answer. This is AI answering. क्या करूं मैं? Publish credible data, clinical studies in public forums, peer-reviewed journals, recommendations. These, many of you might be doing a lot of consensus studies, and this goes in a journal, open access. These things happen, but you don't know that by default AI is picking up. So this is now by design necessary. Earlier it used to happen, maybe we have done it by default. हो रहा होगा, हमको benefit ले रहे थे. But now it is by design. Main recall, AI search, optimize brand name plus molecule in search engines. Very interesting. Medical forums, professional platforms shows, so it shows up somewhere when someone searches Asakulina. This actually a last jo point hai. It has nothing to do with AI. It is told what pharma should have done 10, 15 years back when digital came in. Right? So these are some of the areas, peer-reviewed journals, which I feel should be, where you should do press, PR. PR, I mean, PR is another topic, very interesting topic. We had this session somewhere. It doesn't mean that you are doing PR to public. There are many platforms which goes only to doctors. You can use that, but it has a good Google presence, Google traction. And if Google can read, AI will read. Huh. You might be thinking, you might be having a microsite. Nothing. Google will not see it, your microsite, until unless somebody clicks and you have pushed. It will not come in Google until unless any site is Google registered. Google register will come up only there, and then AI will pick up. So if you are having some microsite by xyz.com, this thing, it is good on your resume, Google will not see it because it is commercially registered site or the domain name. So understand, if it is not on Google registered websites, your content, AI will not pick up. Right? Just say NPPA, your CDSEO, these are all Google registered because they are not a profit making organization. They are general organizations. So they are credible for their content. So if you are doing for your company name, Google will not pick up until unless your search is so long, which normally I think you and me both know patients won't do that. So at the end, last slide, I'll not go into last question. I have a few, 3, 4 slides remaining.
So team, can you pop up the last question? Yeah, so it is talk about which would hurt your brand, losing all retail shelf space, vanishing from AI default recommendations, both equally, neither doctor prescription matters. So some of you still feel that doctor prescription matters, but many of you feel option 1 and 2 makes more sense, that you have to be equally present in the retail shelf place. Plus, your brand should be visible for AI to recommend. So this is what I am able to see. We have got more than 45 people participated by no, right? So I would like to publish the result. We have given 1 minute for the people to participate.
In fact,
Uh,
I would rather disagree with this. Reason being, I'll give you a live example. Looking at this, I'm surprised why people are thinking both equally. It should be vanishing from AI default recommendations.
yeah,
I gave you 2 examples. One of that Lenskart and this thing. I think everyone uses Blinkit, Zepto, and all. You open something,
yes,
something pops up, and you inadvertently buy it, though you don't need it.
absolutely.
Right? That you don't do when you go to a shop. You go to a shop with specific यही चाहिए.
Hmm. And you
Right?
get very less time to think over and switch over.
Exactly. So I think 100% should be my option would be number two. If you
Hmm.
are not there, if it is vanishing from AI default, maybe 3 years, 5 years down the line, everything will go.
Yeah, great. So over to you. I think there are some interesting questions also which are popping up.
Yeah, last few slides, what
Yeah,
I had committed on what to remember.
yeah,
So this is my take, my understanding. What is meta? I told you out of all the story and this thing, I have not given you any gyan. I just gave you facts, figures, what is happening in my perspective, my opinion. So what is this meta? Just for remembrance, it has nothing, it is not published in any textbook. Mark Zuckerberg has nothing to do with this, right? So it has only thing to do with me because I am a lazy person. I remember by this. So what is meta? First one, media training. You need to understand how media works, which pharma may I always keep resonating. Luckily, I was media trained by one of the senior guys and one of the big PR agency. So media training is not about mass media or a particular case. How the news spreads. What is the discoverability of the news? What is the newsability of the news? जैसे for example, I always tell, एक कुत्ते ने आदमी को काटा. The dog bites man doesn't make news, but a man bites a dog that becomes a news. So how this news spreads? What are the forums? How many of you know what is routers? How many of you know what is ANI? How many of you know what is PTI? What happens there? How many of you know how the press or this thing comes? And to the very interesting thing, whatever you read in the headlines, newspaper and all, the headline is always, even I didn't know this. The headline is always written by the editor, not the journalist. The journalist only gives the content copy. Headline is decided by the editor. So what headline comes, the reporter doesn't have any control. Rather, some recommendation is there, but editor is the final take. So
that's
how
a first
media
level
works?
attention.
How digital media works? What is Google indexing? What is Google traction? How your medicine is going? Because all your medicines are today on 1 mg.
Yeah,
And now with so many platforms coming in, all these quick commerce and all, what they are perceiving, from where they are purchasing, at what rate they are giving. And many of you handling brands may not even be knowing how Zepto might be giving 20% discount when your official discount is nowhere. So find out what is media trending, how the news goes. This is one very important. Again, second, emotional algorithm, how to build the stories. That is E. Learn about it. Train the AI. How to train? I told you, be on those sites where publicly available. If you have publicly available sites, integrate with your company name, integrate it with your Google. Use good keywords which Google can trace and further AI can come to that. So how, and think like a patient. As a patient, what will I, as a patient, I'll not say, what is my hypertension today? Example, is my BP under control is a common patient language. So these things are very important. And lastly, AI contexting and branding, your character typing of your brand. Your brand has to have a character. Earlier, it was not much necessary. Like Prestige has pressure cooker, has a feminine character, has a perception because that is related to female. Somebody is having denim more and men. Levi's more male, female because they advertise that way. And I remember, I don't know how many of you remember, the cigarette brand Marlboro? Marlboro was first launched as a female cigarette way back. Check the case study. Marlboro was a female cigarette. When they didn't grow and something of that nature happened, or something like, females were more smokers, now they wanted to shift men. They did a survey. What survey said? What is manly for you? Manly or macho? Macho means cowboy, and that is how cowboy came into Melbourne. Cowboy became a synonym with, visual representation of Marlboro. So this is how context setting, which we used to do, AI will also do. And these are the cases which are published, and many cases. Have a habit of reading cases. You will love and keep noting. Always note. So basically, form opinions, build media handling, digital presence, footprints. What is the digital footprint? Don't just launch with LBL, monograph, LBL1, LBL2, visit one, visit two. Nothing will happen. That will work. I'm not saying no. I'm not demoralizing you, but at the same time, your doctors not just are in front of your reps or you, they are in front of phone also. Are you there in their journey? That is more important. So last, EAM predicts, I already mentioned, emotional mapping via stories, visuals, expressions, all these things. And finally, peer-reviewed journals, all authenticate, use all which are compliant, Google compliant, text compliance, not gross. Google also has a tendency to remove the gross. If you put too much of operatives, pictures, operations, and all, Google doesn't show it. So gross category it comes. So learn about how Google shows the answers. Learn about more this thing. So this is what my take. Sorry, I've taken a little bit longer time. Uh, I hope I didn't bore you. These are my personal thoughts and this thing, though small part of AI. I'm still learning. Have a habit of learning every day, reading every day, at least an hour. So that's it from my side. Thank you for all listening to
So
all
there are
these
many
thoughts.
questions which are popping up, Pawan.
Yes, sir, I'm open.
Yeah,
Open, open.
and
Shoot.
one thing which was actually bothering me, or probably I wanted to ask you, there is a school in Bangalore where they have tried to replace teacher with a robot, and this robot is teaching the students, which are actually live students, human beings. So robot is teaching a student. So do you feel in future pharma companies may recruit robots in place of pharma marketeers to play the role of pharma marketeers? How practical it is?
Possible. I'll tell you, give an example. Many of the people sitting here would be having some, platform today they are using for training their medical reps, which is something related to. There is a doctor sitting there,
Yeah.
but he is not a doctor. It is a AI model. The brand manager feeds all the required
Keywords.
context about the brand, and the medical rep details it,
True.
and the AI will answer,
True.
right? AI will answer. So does that mean that training department is replaced?
Possible.
I don't know. I don't have any mistake. So like what you told in the starting, Sam Altman told you can't replace a human performance. It will augment.
Yeah.
Yes, if some institute has put up a, AI robot, it may be physical robot, but even without a robot structure in front, you are using Google, you are using your chat GPT itself is a robot, your mobile is a robot. It is also answering you. So that doesn't mean it replaces your this thing. So I don't think it is replacing marketing as such by you know by AI. Reason being, humans don't hallucinate. AI hallucinates after some time. So it needs a corrections. So using AI, humans can much better be emotional, much better storyteller, much better brand guy. So I don't think on a long run it can be augmentation. I have even we all have read some story of China starting all AI doctors. It happens.
Yeah. True. Great. Wonderful. So, so we have some questions which are popping up. There is one question which was popping up from Sailesh. Sailesh says that how can AI help optimize pharma sales force effectiveness and digital marketing spend? So these are the two concern areas or probably the priorities for any pharma marketeers that they want the best from the sales force and the marketing spends has to be spent wisely. So how can AI help in this particular journey?
See,
Pawan, you have any
personally, if you
thoughts?
see this question is generic in terms, it's not just from Sailesh, it is from everyone who is in pharma.
Yep.
What is the possible? There is no one answer, if you ask me very honestly. It is a
Mm,
continuous upgradation.
mm,
There's something called as Julius AI, which helps your Excel data churning. In SAP and things which we normally do is we see call average or what is the average time spent and what is we don't see what was spoken. We
yep.
don't see whether the visual aid has a quality of dialect.
Perfect.
We just see it might be open and start talking about cricket. It doesn't mean that 30 seconds to 1 minute in front of a doctor it has been spent and the doctor and MR is speaking about something else. What is the quality of communication? That can be improvised. SAP not only I feel should see the number of calls, number of average, kitna call average, blah blah blah. It also should see what is happening inside the clinic, what is the kind of dialogue which is happening. Though again, यहाँ पे issue आता है, you can't record or visual record or audio record what is the discussion between doctor because you don't have the consent. But that area can be improvised using, you can even put your visual aid on your chat GPT perplexity and ask it review in a proper way. Again, prompting is very important. If you prompt it, is it right? Is it wrong? Where is the mistake? Blah, 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 blah. You are an expert. And then coming to that. So that is one. Second part in terms of cost optimization, you mentioned. Cost optimization is always, see, there's nothing called as cost optimization using AI. It is whatever you are spending, you can do 10 times more rather than you are spending 100 rupees by AI, you will spend 50 rupees. No, think in a way that you are spending 100 rupees, but you are utilizing complete 100. Like example I showed in quick commerce and all. So almost 30 to 40%, sorry, 70% of certain companies' sales is coming from quick commerce.
Yes.
Imagine. So instead of using AI to reduce the cost, I feel we should invest more and enhance the outcome which we were not expecting earlier. How many, like, in our
Mm,
days, we used to do cycle meeting slides and OHP slides. So we didn't have time, patience, everything. We used to have minimum slides even for launch. I have launched brands which are of 12 to 15 slides.
mm.
Today, one basic paracetamol is launched, 50 slides, control M, this animation, this comes from there, where, I don't know, we are habitual to that. So improve the efficiency.
Perfect. So I think to add to what Pawan is saying, segmenting, targeting, positioning, these are the three areas where we keep talking in all our webinars. And when we talk about data, the HCP data and connecting to the right set of HCPs, AI definitely plays a very important role. While you feed that particular data, AI will definitely prompt you and tell, are you going in the right direction or not? So that is definitely one more use case where I have seen large companies using AI to revisit their list of MSLs and definitely see and categorize the customers based on the potentiality and the inclination of the molecule. And that comes over a period of time. And with the ease of AI, it is able to definitely give you that particular insights. So there is one more question which is coming up, which says that wanted to ask, how can pharma ensure that algorithm nudges the AI-driven prescription, do not create brand bias, but remain patient-centric?
Come again, read it again.
So how can pharma ensure that algorithm nudges the AI-driven prescriptions, do not create brand bias, but remain patient-centric?
Again, patient stories. I'll tell you.
Yeah.
A lot many ask us in one of areas wherein all these brands, so-called healthcare internationally, which I have read, I'm not precisely pointing out to the number, but a random number I'm telling. 25 to 30% of a marketing budget internationally, even in pharma, is for digital.
Wow.
India, it is very less.
Less than 10%?
It's less than 10%. And that 10% is also, they think it is for iPad purchase किया वो भी इस बजट में आता है. So it is not digital marketing. So iPad purchase किया हुआ भी इसी में आता है, वो उसका भी 6%. So anyway, point which I'm trying to make here, you make LBLs, right? People keep asking, अरे डिजिटल में स्पेंड किया, एआई में राइटअप के लिए, बॉस पूछेगा इसका आउटकम क्या है. मतलब बॉस को पूछो कि भाई आपने 1.5 लाख रुपए दे के 50,000 एलबीएल बनाया है और 50,000 एलबीएल का आउटकम बताओ, हर एक कहाँ जा रहा है. आप हर एक एलबीएल बनाते हो 10 रुपए में, बट डिजिटल आपको वही और वो भी 2 ही मिनट देखता है, 10 सेकेंड देखता है डॉक्टर, एंड फेंक देगा एवरेज. But with AI, digital, everything, you are getting the same visibility of 10 seconds, 20 seconds at 20 paise, 10 paise. Where you are spending 10 rupees for a LBL, वो कहाँ जा रहा है, God knows. So the point which I'm trying to make here is how well you see against, I told you, brands don't speak now. They behave the way they want to tell. If Nike is doing XYZ, they will behave Nike way. You don't have to just preach, you have to behave. So brands also will require that way in terms of here. So that is how CRM, your what you call CSR, sorry, CSR and all related to the therapies keep happening. So there are a lot of possibilities in terms. Again, patient centricity and bias ना create करने का एक ही reason है. If you have genuine stories, genuine content, genuine sites and published in Google, genuine centers, you will definitely get a genuine outcome.
Perfect. So there is one more question which is coming from Sailesh. It's a classic case where he says that if a brand is 60-year-old with a size of 80 crores annually and currently at a maturity stage, how can AI help bring back it to the growth phase when an updated molecule is introduced in the same category digitally?
One very interesting question. A 80 crore brand, 50-year-old molecule, multiple things. Here, AI is not the answer. Here you are, and if you are saying that it is you are in maturity stage, I doubt, very honestly. The reason being, for me, product life cycle is a very good excuse for our bad marketing. We have done this. PLC is a very nice structure, MBA में पढ़ने के लिए बहुत अच्छा है. Growth, maturity, decline, blah, blah, blah. But what is the relevance? If you are a leader, 80 crore brand, you redefine the therapy, no? You enhance the therapy instead of working on sharing, taking a larger share of the cake. Why don't you think in terms of enhancing some new repurpose around that brand? There are many examples wherein old brands came into growth. Even in my own brand cases, two or three cases I have, wherein we never thought what was the market, what was there. We thought number of patients. We thought number of how many patients are our customers, not how many doctors are our prescribing. How many patients are taking. So if you are wanting to build so-called as per PLC formula, that you want to build a brand and bring it back to growth, this thing, grow the market. You be the defining point. There are multiple brands which are examples, which officially I can't tell, but there are, I think many of us know that a
Yeah.
dying molecule has come back or a old molecule has been repurposed. You know, how to redefine the therapy. There, AI is not the primary tool. Your purpose is the primary. आप करना क्या चाहते हैं? You have to keep the relevance of the molecule even if some new molecule has. There are many molecules which have come over and above, right? You know, valsartan, you have to take metformin. They have not, lost their relevance. So how you put the relevance of that molecule back into therapy and reshape the therapy, that is more important. And use AI for that. And legacy.
So there is one more question which is coming from Nitin Nehte. He says that how can AI be help to detail for doctors as they are not giving time nowadays?
AI also they'll not give time. Who told that doctors will give time on AI? See, don't see simple again. Honestly, you are going to a movie. I remember doing this. I was in a movie theater long back. Movie theater, and I was already late, and I was rushing. I didn't want to miss the first part. Parking ye वगैरह कुछ issue. And inside a movie theater, this guy comes from some क्या है, property. Sir, we have a sea view, this thing, building flat. Do you want to see inside the theater while entering the? So I told मेरे को sea view नहीं चाहिए, D view चाहिए. बोल के निकल गए. So nobody will give you time. You have to find time in terms. AI is not a time giver. Again, human element. Use AI for enhancing your potential. हाँ, अगर क्वेश्चन ये है, I always give this example when you see Johnny Lever. How many of you smile now the moment I say Johnny Lever? The same thing happens when he comes on the screen. He has not spoken a dialogue and this thing. It is just that people know that something funny is coming, so they smile.
Yeah. That's the brand emotion.
Same thing happens with your brand. If doctor knows that some boring thing is coming, then he will never give time. If something interest is coming, your story is interesting, some new narrative is interesting, then he will give half an hour also. I think I don't need to answer. Everybody is pharma and they have worked in the field. They have taken good calls wherein they have spoken for half an hour. It all depends on what content. See, AI again,
Right.
don't get too much into AI stuff and this thing. Think, use your brain and use your brain to know what to use from AI and not what not to.
Absolutely. Using it wisely is more important. Right. So there is an interesting question which is coming up. I come from down to up. So Ramesh says that can pharma marketeers be totally dependent on AI? Will this affect the MR job? So I think as what Pawan was showing that uh, doctor availability of medicines and plus creating prescriptions at the doctors is your responsibility. Definitely AI can't do that. And that can be done by your MR only. So if that answers, Pawan, anything you would like to add
Yeah,
on
I
that?
understand. This is a good old answer, which I think everyone will know. There's no amount of digital, no amount of AI can replace a human smile.
True.
We all are, we all are humans. Doctors are also humans. Maybe they are using AI for some time. They'll get back to their patient. अब AI से आंसर निकाल के वो डॉक्टर ट्रीटमेंट नहीं देगा. But with AI, you can be in their journey so that it gives a memorability, enhancement in their memorability कि भाई ये है. That is where in advertising we always call as sign of what is called seven signals. I forgot a point of seven something. Like example I'm giving. If a car is launched, you will see the front paper news of that car, the ad. You open YouTube, you will see the same car ad on YouTube ads. You go out, you'll see the same car hoardings
Yeah.
for next 2 or 3 days, consistent. So
Mhm.
the simple psychology to this is if a brand is not hit 6 to 7 times in a
Exposure.
limited span of time, memory is not gained up. And
True.
that is why always in pharma हम बोलते हैं कि first 5 doctors are very important. Focus on them.
Mm.
You
Mm.
know, there's a very good old, very bad concept which I don't want. If somebody is using this, please stop it. Pharma में एक common answer है. We will go all out. वी विल गो ऑल आउट मतलब क्या है? मेरे को आज तक समझ ऑल आउट मतलब किधर सब जगह जाके तुम ये करो आई डोंट नो दो इट इज अ कॉमन लिंगो वी विल गो ऑल आउट इट्स नॉट दैट यू गो टू वेरी स्पेसिफिक दैट इज हाउ एआई विल हेल्प यू.
Absolutely. So yesterday I was watching that video between Nikhil Kamath and Sam Altman, where Sam Altman really challenged Nikhil. Nikhil is having about 1.6 million subscribers on YouTube, and he says that the interview that you are doing, AI can do it much better than you, but AI cannot get the fan following because of the emotions that you are carrying. It can answer it in a better way. It can keep the other person engaged in a better way, but the emotions and the human factor is definitely missing. So this is what it is saying. Prashant has got one question. He's saying, what digital intervention generally sees a better traction for doctor engagement these days from your experience?
सॉरी कम अगेन.
So which digital intervention generally sees a better traction for doctor engagement these days from your experience?
I This is the most common error I think approach. The window you are going is from which this thing um, digital intervention. No.
Yeah.
Don't go from this side because some suppliers come to you, हम ये करते हैं, हम वो करते हैं, भाई तुम दिखाओ, हम ये भी करेंगे. This is going from this window. Go
क्या
ask
दूसरा
your
ब्रांड क्या
doctor.
कर रहा है बताओ हमको.
हाँ, तुम लोग हमारे लिए क्या करोगे वो बताओ. This is how pharma companies always, brand managers always ask uh,
एजेंसीज.
agencies. This is a wrong window of looking at it. For FMCG or other things, they don't look at it this way. I'll give you an example. FMCG and other companies, they first reach out to mass number of select customers. They do an in-depth study, what they do, what they, how they behave, what they write, what they eat, what they do. Then they go there, right? So it is not that which platform we should use. You go ask your doctors, ask, do a survey, na? All your so-called, if you are targeting pediatricians or any certain age group, you take 200 doctors, ask them some tricky questions like how much time you spend on mobile, what do you search, what kind of searches, what you'll see a lot of new things coming up. And then find a platform to reach that point. If he is
Absolutely.
using news, then go to the news channel. If he is using too much of Google, then build up your site. If he is
Hmm.
using too much of WhatsApp Gyan, then format a group. You reaching through
Absolutely.
WhatsApp. It is the way we are looking like. See, we are hardcore pharma people, not tech people. So we are vulnerable that any tech people will call us as suppliers and they'll tell, "Bhai, hum ye some big jargons," and we fell for, fall for it. It's not that. You first ask your customers where is he going.
Absolutely. Media habits.
Then you intervene. So that is how digital AI comes.
Absolutely. So Shardul has got a in connection same question. So what he says that today many companies are not in the favor of digital promotion because of the ROI. How AI will help increase H to H, human to human emotional connect for getting doctor prescription. How AI is going to help in deciding doctor prescription behavior based on PDBC.
Okay.
So Shardul,
So
are you
the
there with
same, the
us?
same, same question which I answered.
Yeah.
Yeah, many companies are not interested in, you know, doing digital promotion. The problem here is I always tell this statement. This question comes in every forum, and this is my standard answer. The decision makers are not, tech savvy, and tech savvy people are not decision makers. So they don't know what is AI. They don't know what is digital, how digital can help. I gave an example of LBL. You print a LBL for 10, 11 rupees, 15 rupees literature. make 50,000 copies, cost you 10 lakh, 20 lakhs. What is the ROI for that? तो 15-10 रुपए का आप भेज रहे हो LBL, अब सारे 50,000 के ROI आप कैसे मालूंगे? आपने कुछ भेजा, फार्मा में बाय डिफॉल्ट क्रेडिट बहुत है, लेट मी बी वेरी ऑनेस्ट। आपने कुछ तो किया, कुछ तो हुआ, सेल बढ़ गई, we assume that this happens because of this.
Yeah.
And many of the times, the reason is something else. Go ask some 10-15 doctors, it might be something else,
True. True.
genuine doctor. So digital is again, there is no principle, different thing called as digital marketing. It's all sold up concepts. There is nothing called as digital marketing. It is marketing in digital world. Khatam. Principles remain same. So you
Absolutely.
are investing there, you are spending 10 rupees to reach one doctor, digital will give you 20 paise, 10 paise, if you are at the right spot.
Perfect. So we've got 5 winners, which I would like to announce, though there are a lot of questions which are coming up. We'll be happy to share the mobile number, email ID of Pawan sir, so that you can continue the discussion and your knowledge from Pawan. The 5 winners for today, first is Gaurav Jain. Gaurav Jain, if you're there with us, team, can you please spotlight Gaurav? Second is Vivek Kumar P. He's joined us from Apex Labs. Third winner is Farouk Chanda. He is joined from Palson Derma. The fourth winner is Amrish Kulkarni. He has been very active in the chat. And the fifth winner is Nikhil Kohli. He has also been very active in the chat. So congratulations to all of you. And if you are there in the chat, you would like to talk to us. Hi, Gaurav.
Hello, sir.
Yeah. You're on mute.
Gaurav, you are on mute.
Yeah.
Yeah.
I'm the luckiest person. I work with Pawan sir regularly.
Okay. Wonderful. That's a blessing and
I have nothing to do because I didn't know he was here.
okay. Great, great, great. So, with that, we would also like to take a feedback on what we have done. Congratulations to all the winners, and my team will personally call you and take your details so that the hard copy of the book, which is Whispering to AI, will be delivered to you at your doorstep. And we would like to definitely hear about how the webinar has been of use to you. We would also like you to put down the 3 skills which you feel as pharma marketeers after listening from Pawan is very, very important in the AI era. Please put down the 3 skills which are important in the AI era that pharma marketeers has to go and acquire. So these are what are the 3 skills you feel after listening to us is very important. Parallelly, please click on the link which my team has sent in the chat and give us a feedback. Will be very, very important for us to improve on the topic and the speakers. This is the 18th webinar, and it's all because of the blessings and the love that we receive from the people that we have today as participants. And we have broken a new record today with having more than 175 plus registrations, having more than 100 plus people joining us across India. And we are now coming to the end of this particular session. Please give us a feedback. Click on the link which is being submitted by my team. And with that, we would like to also tell you what Medgini is doing for the pharma industry. Medgini is helping pharma companies with regard to awareness, availability, visibility, loyalty, and mobility solutions. So we have been serving pharma industry since 2012, and we've got many customers where we have helped them launch a brand, sustain a particular brand, make the brand visible at the chemist outlets. We have the largest reach of chemists, which is around 5,15,000, and the largest reach of doctors, which is around 7 lakh plus. So anybody would like to work with us, please reach out to us, and the email IDs, mobile numbers will be shared to you in the next window. We are physically present in all the 3 geographies, though we service all over India. That's how Medgini has been doing for the pharma industry till date. And to thank Pawan for his quality time input, there is an interesting book which is going to be released next week from Subha Rao, which is Storytelling in Pharma Marketing, which we would like to give Pawan for his time. And that's his area of interest as well. So that's how my team would like to give it to you as a token of gratitude for your time and knowledge that you have spent with us today.
Thank you so much, and I hope people didn't get bored.
Not at all.
And,
So I think there are a lot of people who are buzzing with the thanks what we are getting here. And with that, we come to an end. On behalf of Pawan and me, we thank all of you to be with
thank
us,
you
be
all.
patient. Right.
Thank you so much. Thank you
Thank
for
you so
having me.
much. Yeah. Thank you so much.
Thank you, sir.
Thank you, team.